We're going to talk next about the adjustable gastric band. You probably know this by its common name, the lap band, and some of you may have heard of the realized band, which is an alternate form of the lap band. Now, when it comes to the adjustable gastric band, you can see in this diagram that the esophagus meets up with the stomach, and where you see the stripes disappear, that's where the esophagus meets up with the stomach. And the band goes around the upper portion of the stomach. And the idea is that it makes a small stomach pouch that restricts the volume of food that you need to feel full at any one time. Now, it doesn't actually make food choices for you, so if you're not willing to make changes in the types of foods that you're eating, then the band is not a good procedure for you. However, if you have problems with hunger and you're willing to make changes and feel like you need some help with your hunger control, then the band may be a good option. Some of the advantages of the gastric band are that it's reversible. There is no malabsorption, as all of the food and nutrients pass through the normal digestive pathway. It is considered the least invasive of the weight loss surgery procedures that we offer. It is frequently done as an outpatient procedure, so for individuals who need a quicker return to work, they are more likely to be able to go back to work sooner after an adjustable gastric band. Some of the disadvantages of the lap band or the adjustable band are that it does require more maintenance than the other weight loss procedures. I like to see in the office at least once a month for the first year following surgery to assess whether or not you need any additional adjustments to your band. There may be some individuals who have worsening of esophageal reflux after the lap band, although the majority of patients do see an improvement. And if you are someone who's been told that your esophagus does not function properly, or if you've ever been told that you have esophagitis, which is inflammation in the lining of your esophagus, then the band may not be the best procedure for you. There is also a possibility of complications related to the band or to the device itself, which would need reoperation or another surgery in the future. Some of these possibilities include a slippage. What we talk about when we say a slippage, it's not the band that slips, but it's actually the stomach that slips up through the band. The band can also erode or wear through the stomach wall, and if that happens, that means that part of the band sits on the inside and part of it on the outside, and therefore it's no longer functional. There can be a system leak somewhere in the balloon or in the tubing or in the port, and if this happens, it renders the system ineffective because we're unable to maintain good pressure or resistance. And you can also have problems with the port, which is how we do adjustments, flipping or turning and rotating on the abdominal wall, which makes it difficult to access the port. The weight loss is more variable with the band, although there are some people who lose a large amount of weight with the adjustable gastric band. There are some people who fail to lose a good amount of weight with the band. And it is more effective for lower BMI patients. Once your BMI gets above 50 and especially above 60, it does not provide as much weight loss and is not the favored procedure. A well-adjusted band is what we call your sweet spot. And what we mean by this is that you have the right amount of fluid or restriction with your band so that you're having good, steady weight loss. At this point, you should be able to eat most solid foods. If you're eating only liquid foods or mushy foods, then your band may be too tight if you're not able to tolerate solid foods that you have to chew. You do have to chew your food very thoroughly and eat slowly. You should be able to comfortably eat a small selected solid meal. There is no limitation of liquids except during your meals, and then no high-calorie liquids. If you're consuming high-calorie liquids, this really defeats the purpose of the band. Unlike some people who believe that drinking things such as fruit juice is a healthier choice than pop, it's still a source of empty calories and it doesn't provide really any satisfaction or satiety, and so we advise that you stay away from any liquid calories other than things such as your protein shakes or meal replacements. Some of the overall side effects of weight loss surgery include nausea and vomiting early on, and this is because your body is adjusting to a new way of digesting food. Your taste may actually change. You're not going to feel hungry early on, but yet you're still going to be forced to eat. And some people have the side effect of nausea. This is usually short-lived. Some people may experience some additional gas or bloating. In gastric bypass patients, there is a subset that develops lactose intolerance after surgery. Diarrhea may be more common early on, especially after gastric bypass, that as time goes on, most people actually tend more towards constipation. If you're a person who normally has a bowel movement now every day, then it may be every 2 or 3 days after weight loss surgery. This is combated by increasing the amount of fiber in your diet and making sure you're getting plenty of fluids. Some people will have to need to use stool softeners on occasion as well. There's also the possibility of gallstone formation with any rapid weight loss. This is a possibility. Some people may experience hair loss or hair thinning, although I don't see this with the majority of our patients because they do a very good job of maintaining their protein intake. However, there is a subset of patients who have such drastic weight loss and there's so many changes in their body that they do have some thinning of the hair anywhere from 4 to 8 months after surgery. This is usually a temporary condition that reverses itself. There is the possibility of nutrient deficiencies. Some people may develop loose skin. For individuals, especially those who are prone to depression, you may actually have a worsening of your depression right after surgery. One of the reasons for this is that you're working very hard for several months to prepare for your surgery, and then the surgery happens. What you'll find is that you're having some pain or soreness from the surgery itself. You're not able to eat normal foods, and you haven't reaped any of the benefits of weight loss surgery yet. And so this is a very common time to experience an episode of depression from all of the physical stress and from all of the major life changes. Some of the potential risk of weight loss surgery: early on, death is a possibility. The risk of death after gastric bypass is considered to be about 1 out of 500 individuals who have the surgery, and this is very similar to somebody who would be having colon surgery, if you've known someone who's had colon surgery. The risk of death after adjustable gastric band is about 1 out of 1,000 individuals who have this surgery. And this is similar to something like laparoscopic gallbladder surgery. So if you know someone who's had their gallbladder out, it's a similar risk to that. There's also a risk of blood clots or pulmonary embolus. And when we talk about blood clots, what can happen after surgery is that the blood flow in your legs can slow. And if that happens, you can form clots in the deep veins in your legs. If a portion of that clot breaks off, it can then travel to your lungs, and then it becomes something called a pulmonary embolus. And if it lodges in a big enough blood vessel in your lungs, then it interferes with the exchange of oxygen, or the oxygen that gets back to your heart, and that's something that could potentially be fatal. The most important thing that you can do after surgery to help prevent blood clots is to get up and walk around. As you're walking, that helps the circulation in your legs. There's also a possibility of bleeding and transfusion with all of these surgeries. And there's a risk of injury to adjacent organs such as the liver, the spleen, the colon, the small intestine, any intra-abdominal organs. There's a possibility of puncturing these or tearing these during the procedure, although this is very uncommon. There's also the possibility of something called atelectasis and pneumonia. And when we talk about atelectasis, basically what this means is that the lower portion of your lungs actually collapse a little bit because you're not breathing deeply after surgery. Especially if you're having some pain after surgery, people have a tendency to not breathe as deeply. And so you get some collapse in the lower portion of your lungs where you're not expanding your lungs very well. If you don't expand your lungs well, then this can lead to mucus trapping, which can in turn lead to pneumonia. There's a possibility with infection. As I mentioned, the infection rate is much less with laparoscopic surgery than it is with open surgery. Infection can be of a big concern in the cases where there's an implanted device, such as with the adjustable gastric band. And the reason why this is because it can be difficult to get the infection to clear around the band or the port, and so it may mean that that device has to be removed and replaced at a later time. There's also a possibility of leakage or perforation, where we make divisions in the stomach and in the small intestine and make those new connections. If those connections don't seal properly, then you can leak contents from your stomach or your small intestine into your body cavity. That's something that could potentially make you very sick. Some of the late complications, and this would be months to years after surgery, include low blood sugar. This is especially true for gastric bypass patients and gastric sleeve patients who are not eating frequent, small, regular meals, or if they're eating high carbohydrate meals that causes a rapid rise and then decline in their blood sugar. There's a possibility of bone loss, and the reason why bone loss is more of a possibility after weight loss surgery is because at your current weight, with the heavier weight, you actually stress your bones more, so it leads to stronger bones. But as you lose weight, your bones do not get as stressed, and so the bones may weaken, and especially with the malabsorption or the decreased absorption of nutrients, this may impact bone loss as well. Some people experience transfer addiction. This would apply to people who are actually addicted to the food, and it's not uncommon to see them move on to other things such as alcoholism or tobacco abuse. Suicide is a higher risk or higher rate after weight loss surgery. Although it's not common, it is considered to be more common in obese individuals who have weight loss surgery than those who have not had weight loss surgery. There's also the possibility of hernia formation, although it is much less with laparoscopic surgery in terms of forming an abdominal wall hernia. But there is a special type of hernia that you need to be aware of that can occur after gastric bypass surgery. And this is something called an internal hernia, which is where the bowel actually can become twisted on the inside of the intestine, in between loops of intestine. This may lead to crampy abdominal pain, nausea, vomiting, and it's very difficult to diagnose at times. And so if you're experiencing these symptoms and you have not communicated with your weight loss surgeon, it's best to talk with them to see if this may be a possibility. And there is a need for possibility for a need for additional surgery after any of the weight loss procedures. Some of the benefits of weight loss surgery is that it offers sustained weight loss and substantial weight loss in the majority of individuals. We also see a great improvement in the quality of life. We can expect to see an extended life expectancy, an improvement in your energy and your overall self-esteem, and a decrease in your prescription medications that you take for your obesity-related health problems. We see an improvement in things like type 2 diabetes, high blood pressure, reflux, heart disease, joint problems, and a whole host of others. Thank you for joining me for this portion of the weight loss surgery descriptions. I look forward to meeting with you in the office soon.